The U.S. Surgeon General has issued a new advisory about the effects of social media on adolescent mental health. The report said, quote, while social media may have benefits for some children and adolescents, there are ample indicators that social media can also have a profound risk of harm. The Surgeon General calls on policymakers, technology companies, and families to ensure social media environments are safe for young people. And joining us now is U.S. Surgeon General Dr. Vivek Murthy. Good to be with you again. Let's start with where things are, because we've been hearing a lot about the harms from social media for a long time. Is it worse than we thought?
Well, I'm so glad that we're talking about this, because the most common question that I'm getting from parents all across America over the last couple of years is about social media, and specifically, it's about whether social media is safe for their kids. And I'm concerned about this as Surgeon General. I'm also concerned about it as a father of two young children. So we issued an advisory today on youth mental health and social media to answer these questions. And there are two critical conclusions that we came to when we looked at the publicly available data. Number one, there is not enough evidence to tell us that social media is in fact sufficiently safe for our kids, to answer the question again that parents are asking. But the other point that we found is that there's in fact a growing body of evidence that shows that social media use is associated with harms. Consider, for example, that teens who spend more than 3 hours a day on social media face double the risk of experiencing anxiety or depression symptoms. And when you know that the average amount of time that teens are spending is 3.5 hours a day, you come to recognize how concerning this actually is. So the bottom line is we have to take action to make social media platforms safe for our kids. And that's going to require tech companies, but also policymakers to step up and support parents, because parents, they have had to deal with this largely on their own. The entire burden of managing social media and kids, which is quite an extraordinary burden, is one that we place entirely on the shoulders of parents, and that's not right.
Do we need parents, media, educators, do we need a better metaphor for the sense of urgency you're talking about, and for just because this is all in our lives now, and so we become acculturated to it. Is there a need for a better metaphor to kind of wake everybody up to the level of concern that you have and that they should have in order, as a precondition to taking steps to try and fix it?
Well, what's interesting is that when I talk to parents, they are already concerned, many of them, because they're seeing what's happening to their children. Many of them are watching their children spending more and more hours away from friends and from family and holed up in their rooms on their devices using social media. Many of them are recognizing that their kids will feel worse about themselves after they look at their feeds on social media. In fact, this is a common point of feedback that kids share with me all the time. But also the data tells us that about half of young people, when they use social media, say that it makes them feel worse about their body image. So I do think that many kids and parents already recognize and are worried about some of the harmful effects. But one of the things I've been working on for the last 2 years is on addressing the youth mental health crisis that we have in America. I've said many times that this is the defining public health issue of our time. And now we are starting to understand that social media may be one of the key drivers of that crisis. This should be a wake-up call to everyone, but particularly to technology companies and to lawmakers.
And Doctor, I can't let you go without asking, what is one thing a parent can do? If everybody has this concern, what one thing can they do to help themselves?
So we lay out actually a number of things parents can do, but I'll tell you a few. Number one, if your child has not yet begun using social media, then personally what I would recommend is that you try to delay the use as long as you can past middle school. That's what my wife and I are planning to do for our kids. Now, that's easier said than done, and so we know we're going to need help. So reaching out to other parents who may be similarly inclined to partner with them, that helps us as parents, but also make sure our kids aren't alone. But if your kids are already on social media, two quick things you can do. One is to make sure that you are starting conversations with them about their use of social media, so you understand what they're posting, how they're using it, what platforms they're on, but also so that they understand what kinds of experiences are concerning. Too many kids are harassed and bullied and pursued by strangers on social media. 6 out of 10 adolescent girls are saying that they've been approached by strangers in ways that make them feel uncomfortable on social media. We want kids to be able to flag this and come to parents for help. And finally, parents can designate tech-free zones in a child's day around specifically the activities we know are essential to protect for their health and well-being. That includes sleep, in-person time, and physical activity. And that could mean, designating an hour before bedtime and throughout the night is times where kids don't use their devices, designating meal times when families are together as a time that's tech-free as well. And as parents, we can lead by example in modeling the kind of behavior we want our kids to follow as well.
U.S. Surgeon General Dr. Vivek Murthy, thank you so much for being with us.
Of course. Thanks so much.